Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Today, we are going to dive into talking about patellar tendinopathy. So if anybody listened to last week's episode, it was all about Achilles tendinopathies. And one of the reasons for the timing of that episode is that I talked pretty extensively in that episode about why we see a big spike in tendinopathies at the beginning of a dance season. So if you've not listened to last week's episode, it is episode 97, because today is episode 98. And I would encourage you to go back and listen to that one because, like I said, I kind of dive into a little bit of like the background of how tendons respond to loading and why we see an increase in tendinopathies with a increase or sort of a sudden spike in training loads at the beginning of a dance season. After that podcast episode released, I had a bunch of people, or a few different people, who sort of reached out and said, hey, would you do an episode on patellar tendinopathy? I always have issues with my knees. And so that is where this week's podcast episode has come from. So we're doing two sort of back-to-back on tendons, but different tendons in the body. So today will be a little bit of a shorter podcast episode because, like I said, I'm not going to go into all of the background in terms of how tendons respond to load and things like that. We're just going to talk really specifically about patellar tendinopathies. But I do encourage you to go back and listen to episode 97 to really understand why this is such an important topic at this point in the dance season. Also, if you have not listened to episode number 50 of the podcast, which is just about tendinitis in dancers in general, so a very general overview of tendons and tendinitis and the difference between a tendinitis and a tendinopathy and those types of things, definitely go back and listen to that as well. I will link that episode in the show notes. But today, we are talking very specifically about patellar tendinopathy, or this is often referred to as jumper's knee. So you'll sort of hear people talk about different athletes with jumper's knee. They're talking about patellar tendinopathy. So in dance, we don't necessarily call it jumper's knee a lot, but in the athletic world, like basketball and volleyball and things like that, you will definitely hear it called jumper's knee. So it's all the same. That's what we're talking about today. So as a little review, what is a tendon? What is it that we're actually talking about? So just, again, review from last week's podcast. A tendon is a piece of fibrous connective tissue that attaches a muscle to a bone. And the role of a tendon is to help with transmitting and absorbing or attenuating forces that are being transmitted from the muscle to the bone so that we can have an action happening at a joint. In the case of a patellar tendon, it is attaching our quadriceps muscle. So that's the big muscle down the front of our thigh. And it's called quad because there are 4 different muscle bellies that are all part of the quadriceps muscle. So all of those 4 bellies kind of join together and form into this patellar tendon. And then it attaches to the tibia, and specifically a location on the front of the tibia. So the tibia is your shin bone. So at the top of your shin bone, on the front, there is something called your tibial tubercle, and it's a little knobbly bit. And some people it sticks out more so than in others. Some people it's a little bit flatter, but that is where your patellar tendon attaches into. Now, the patellar tendon is interesting or more unique than, say, the Achilles tendon because we also have this thing on the front of our leg called our patella. So that is our kneecap. And the kneecap actually sits kind of embedded inside that tendon. And so you will sometimes hear people refer to the patellar tendon as a patellar ligament. And so I'm going to get a bit nerdy about anatomy for a second, but a tendon, like we've been talking about, attaches a muscle to a bone. And a ligament, on the other hand, attaches bone to bone. And so some people will say, well, this is attaching from the patella, like from the kneecap to the shin bone, that tibial tubercle. Therefore, it's bone to bone, and therefore it's actually a ligament and not a tendon. Other people say, no, it's all one continuous tendon that comes from the quadriceps, and the patella is just embedded in that tendon. It acts as what we call a sesamoid bone. So a sesamoid bone is like a floating bone, basically, that's kind of embedded within a tendon. So again, this is a little bit of like semantics and probably more in-depth anatomy than you really need to understand, but it is really important to understand about how the patella affects the patellar tendon, because essentially what the patella does, or what the kneecap does, is it allows the quadricep muscle to act as a little bit more of a pulley, and it kind of changes the direction of force transmission, because otherwise the way the quadricep muscle would attach directly into the tibia or the shin bone, we mechanically wouldn't have as good, that's not the right word, but we wouldn't have as much of a mechanical advantage and be able to produce as much power and as much strength as we can if we didn't have this pulley system that is helping to sort of attenuate and transmit some of these forces. So again, that might be a little bit too much kind of anatomy and physics for some of you. It's not super, super important, but it is an interesting difference between the patellar tendon and a lot of other tendons that we have in our body, like the Achilles tendon, that's pretty straightforward, where it just attaches the calf muscle into the back of the heel. The patellar tendon is a little bit different because we have the kneecap that's kind of embedded in that tendon and influences the pull of the tendon a little bit more. So that's all I'm going to say about the anatomy of it. But important thing to remember is that tendons attach muscles to bone, and their job is to help transmit and absorb or attenuate forces that are being produced by the muscle and then acting on the bone or acting on the joint. In people who have patellar tendinopathy or have this jumper's knee, or dancers who are complaining about this, in terms of like signs and symptoms and what we are looking for or what dancers might be reporting, it often starts out as like a really kind of like low-grade knee pain, and it is generally or almost always like a pretty gradual onset, where at first people might be like, oh, my knees just hurt a little bit if I do like a lot of grand plie or a lot of jumping. They're just like a bit sore afterwards. And then it will often sort of progress to there that they will get more kind of localized pain. And in a patellar tendinopathy, it's really common for the pain to be very specifically localized within that tendon. People will usually point and be like, it hurts here, and point exactly to the patellar tendon. Whereas in some other knee conditions or knee things, it's like, well, sometimes it hurts on the inside and sometimes it hurts on the top of the knee. And sometimes it, like, people are a bit more vague about where it is like hurting, because the pain can travel around a bit more. In a patellar tendinopathy, most often they're going to be like, it hurts specifically here, and it's usually like one fairly pinpoint location right in that patellar tendon area. Sometimes we'll see swelling in that area as well. Again, if you've listened to episode 50 when we talked all about the difference between tendinitis and tendinopathy, you'll know that inflammation is not always a part of a tendinopathy, or is often not a part of a tendinopathy. And so with these, we don't always see swelling, but we certainly can see swelling in a patellar tendinopathy. So there may be swelling in that sort of like inferior knee area or below the kneecap, like underneath the knee. We might see some swelling in that area. Similar to the Achilles tendon, people will often report that the knee feels really kind of like stiff and sore in the morning when they first are starting to get going and starting to move about and starting to try and go like up and down the stairs. People will be like, ooh, when I first have to go down the stairs in the morning, it's really sore. But then it kind of like warms up, and they will feel like, oh, like it's warmed up. It's actually like not that sore, until they start to load it or challenge it more, which might be with like jumping in class or something like that. And then the pain will increase again. So again, that kind of really typical for a tendon presentation of stiff and sore in the morning, warms up and goes away, but then comes back with increased activity later on in the day. That very much holds true for the patellar tendon as well. Most of the movements that dancers are going to experience pain with are things like landing type movements. So jumping, hence why it's called jumper's knee. Landing from jumping is one of the most common ones, and people will describe pain with landing from those jumps. Pain with running a lot of the times too. Our dancers aren't always running, but if we are running as cross-training or even just running on stage and things like that, they might report pain with running. And pain with kind of like plie or lunge type positions, and especially the deeper you go. A lot of people, they're like, oh, I'm fine with a demi-plie, but when I get to a certain point in a grand plie or kind of like lunging or things like that, that is when they start to experience more pain. We will also often have dancers who struggle with kneeling on the affected knee. And this is going to vary a little bit depending on what position you're kneeling in, because there are some ways that we kneel where we're actually not right on the patellar tendon. Like we might actually have most of our weight like through our shin bone, and that actually might not bother people at all. So they're like, oh no, I can like kneel, no problem. But depending on people's anatomy and the kind of, like the structure of their knee joint and their lower leg, and then what position they're kneeling in, there are positions that can actually put a lot of pressure directly through that patellar tendon, and that might be really bothersome to them. And oftentimes what you'll hear dancers describe is they're like, it's moving through certain kneeling positions. So they're like, I'm fine once I get to the position, and that's often because then they're loading more like through the shin itself. But there's like a moment where they're like loading through that patellar tendon where that can be really painful if the tendon is already irritated, that having that body weight or having that weight. So definitely kneeling can be an issue as well. But the biggest ones we're going to see are jumping, and especially landing from jumps, and then plie are the ones that tend to bug dancers the most with a patellar tendinopathy. When we are assessing and treating patellar tendinopathy, we want to be aware of other kind of differential diagnosis that it could be. So similarly to when we talked about Achilles tendinopathy and we were talking about posterior ankle impingement being something that might be mistaken for, in the knee with a patellar tendinopathy, we want to make sure that we're ruling out a patellofemoral pain syndrome. So that is an issue that has more to do with like the tracking of the kneecap. So it can present similarly in some ways, but oftentimes in patellofemoral pain syndrome, the tendon itself is not the issue. The tendon might still be totally healthy, but the sort of symptoms or signs that they're experiencing might be a little bit similar. I actually do have a podcast episode all about patellofemoral pain syndrome as well. It is episode 59. So if you want to like listen to exactly what that is about, I will link that in the show notes. But something to be aware of with our differential diagnosis. And then we also want to be aware of chondromalacia, which is essentially irritation of the like cartilage in the knee. So this is more an issue that is like internal to the knee joint. And actually chondromalacia can be one of the things that happens with a patellofemoral pain syndrome, where if we have tracking issues, it can lead to a chondromalacia. So they can be related to each other. They're not the exact same thing. But those types of knee issues will sometimes get mistaken for a patellar tendinopathy. But like I said, in a patellar tendinopathy, the pain is almost always very localized to the tendon. People can really pinpoint exactly where the pain is happening with specific movements and specific loading patterns of that tendon in through there. So that's kind of what we see in dancers in terms of like presentation or signs and symptoms. As far as treatment or management of a patellar tendinopathy goes, this is going to sound fairly similar to when we talked about Achilles, obviously a different body part, but number one thing for treatment of a tendinopathy is looking at load management. So again, we talked tons in last week's podcast episode about how tendons respond to loading and how it takes them time to adapt to that loading, and they don't like sudden changes in load, whether that is an increase in load or a a decrease in load. So we need to carefully manage load when we have issues that are affecting tendons. And this means oftentimes we don't want to completely unload the tendon. Again, sometimes people are given the advice that, just take 2 weeks off dance, take 6 weeks off dance, just rest. It just needs rest. And oftentimes that is actually exactly not what it needs. What it needs is modification of loading and controlled loading programming, or like a controlled load protocol, but completely resting a tendon is often counterproductive. So load management is the number one thing for treatment, but not necessarily completely unloading it. It might be unloading it to a certain degree. We might need to unload it by 50% or unload it by 20%, but we don't want to completely unload it. Number 2, because the patellar tendon originates from the quadriceps muscle, we want to make sure our quadriceps muscle is functioning appropriately. And number 1, we want to address any restrictions or tightness that is happening in the quad muscle. Very, 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 very common in dancers that we will find that there is a lot of tightness within the quad muscle. That is the thing that is pulling on the tendon, or sort of changing the mechanics of how the tendon is able to transmit load. And that is one of the things that is irritating the tendon. So one of the things we're always working on, or always looking out for, is making sure that we have appropriate muscle length and appropriate muscle tone. And what I mean by tone is like how much tightness is in the muscle when the muscle is relaxed. We want to make sure that we are addressing those. One of the things that can be tricky with a patellar tendinopathy is, depending on how irritated it is, sometimes going into traditional quad stretching position. So, I call it like a standard runner's quad stretch. I don't actually know if it has a name, but it's the stretch where you're standing and you reach for your foot and you pull your heel or like your foot towards the back of your hip. Knees are sort of like staying next to each other to stretch out the front of the thigh. Really standard, very straightforward quad stretch. However, in a patellar tendinopathy, that position is putting the tendon on maximum stretch. And if the tendon's already really, really unhappy and irritated, that can be really painful or very irritating for somebody with a patellar tendinopathy. So that's not to say we don't want to address tightness in the quad, but we might have to think of other ways to do that. So we might actually look more at hands-on myofascial release techniques, or using foam rollers to roll things out, or using techniques like cupping or acupuncture or IMS or things like that to address the quadricep muscle if they're not able to get into positions to actually actively stretch out the muscle. There are some other positions that we can use to try and stretch the quad without coming into so much knee flexion. But really, at the end of the day, to maximally stretch the quad, there is a certain amount of knee flexion that is required. And if the tendon is really irritated, sometimes that's not accessible to us. And we need to go after some of those other things first. And then we will have more ability to actually stretch out the quadricep muscle. But it is certainly something we want to address, is any dysfunction happening within the quad. Then we want to move on to actually thinking about loading the patellar tendon, and doing this via loading the quadricep muscle. So really working on loading and progressive strengthening through that quadricep muscle, and therefore loading the tendon. Again, depending on the level of irritability in the tendon, we might actually have to start loading the quad muscle with the knee in like a fully straightened position. So there's no stretch on the patellar tendon at all. And so we call this like a straight leg raise type movement. So you'd have your knee totally straight, and then you're working on doing like little leg lifts to work the quad muscle, keeping the knee totally straight the entire time, as a way of accessing strengthening and loading in the quad and in the tendon, but with the knee staying in a totally straight position. I have not seen a ton of patellar tendinopathy within my dancer population that has been this irritated that I have to start at this level. I have clinically seen this a few times in other populations of people, generally older kind of athletes, sort of people 40 plus. They'll sometimes get like really, really ragey, angry patellar tendinopathies, and sometimes we have to start really basic. In my clinical experience, I have not seen a dancer come in who is that sort of like acute or that limited in what they can do. So oftentimes that's not the level I'm starting at with a dancer, but it might need to be the level you're starting at. More often than not, I am going to start with isometric loading through the quad. And we talked about isometrics last week in the Achilles podcast episode as well. But essentially what isometric loading is a contraction of the muscle, but where the muscle does not change length. So the muscle's not shortening and it's also not lengthening. The muscle length is staying still, which the easiest way to think about that is that the joint doesn't move. So you're contracting the muscle, but the joint's not moving. And specifically for the patellar tendon, we really want to think about isometric loading of the quad in varying angles. So we might do this with the knee fully straight, which would just be somebody sitting with their leg out in front of them, like totally straight, and you're just asking them to like switch on their quad, tighten their quad as hard as they can, hold it for 5 seconds, 10 seconds, whatever it is, and then relax. So that would be an isometric hold with the knee straight. Like I said, I don't often need to start at that level. So what we're looking for is starting at varying angles where we're starting to challenge the length of the tendon a little bit more. So maybe we're starting somebody doing an isometric hold with their leg at 70 degrees of knee flexion or 90 degrees of knee flexion or 120 degrees of knee flexion or whatever it is. We might need to start these isometrics with them like unweighted. So they might be in a sitting position or a lying down position as opposed to trying to load them in a standing position. But then we are going to progress them to weight bearing. And we're going to then start to think about, we can still do isometric loading in varying angles in weight bearing, but we can also start to think about adding kind of like more squat variation. So where we're going through both concentric and eccentric loading of the tendon as well. So similar to the Achilles, when we're dealing with tendinopathies and tendons, we're thinking about sort of slow, heavy loading as opposed to doing 25 reps of body weight squats. We're probably going to load them a little bit more, but focus on that slow, heavy, controlled loading. We can think about a lot of different squat variations that are going to load the patellar tendon differently. So sometimes we'll start with, if anyone's familiar with like what a Spanish squat is, but like we often use like a wall for support. So like a wall squat or a wall sit position, because the weight stays further back and therefore there is less load through the actual patellar tendon while we're still getting good strength gains through the quadricep muscle. And then we can progress those to a more quote unquote normal squat variation, or a squat variation where hips are traveling backwards but knees are traveling forwards over the feet. That's going to load the tendon even more. And then we will usually progress these two to a decline squat position. So this would be on like a slant board or some sort of a decline board. So your toes are lower down than your heels. It feels like you're going downhill basically. And then loading in either lunges or squats or things like that in this position, that actually challenges the tendon even more than in a regular sort of squat position. So these are all things we want to think about when we're thinking about how to progressively load the tendon. We need to move through all those various challenges and various angles. And you might find that dancers tolerate certain things really well. Like they're like, oh, I can like really load my tendon through 90 degrees of knee flexion, like no problem. But it's when I get past that 90 degrees. So if I'm getting to 100 degrees or 120 degrees of knee flexion, that's when it starts to become problematic. Then maybe you're like, okay, we're going to focus on some isometric loading at whatever that challenging angle is, 110, 120 degrees, whatever it is, and start to progress with that. As opposed to, I think oftentimes people are like, oh, if it starts to hurt when I get to 120 degrees, I'm just only going to go to 90 degrees. Like they just limit the movement. That is a strategy for modifying what we're doing functionally. But in terms of actually like healing and repairing the tendon, at some point we need to challenge and load the tendon in the ranges where it is not as strong as it needs to be. So at some point we do need to challenge those ranges as well. So we might have a dancer who limits their knee flexion in class to 90 degrees because they know that that's not irritating, it's not aggravating. Everything I do up to 90 degrees is totally fine. When I go past 90 degrees, it starts to hurt. That's a great modification for them to make in class so that they can continue to dance and not make this thing progressively worse or like progressively angrier. But in rehab, or what they're doing outside of the studio, we do need to be challenging it past 90 degrees. So maybe we're challenging it at 100 degrees or 110 degrees, starting with isometrics and then slowly introducing more concentric and eccentric load. Hopefully that makes sense to you. So sometimes when we talk about modifications, what we're doing in class is not the same as what we're doing in rehab, because what we're doing in class is basically trying to modify things enough that we're not making things worse. But in rehab, we're actually trying to improve and push things forward, which will then translate into them being able to do that in class. All right, so we're going to address quad loading or quad strengthening as one of our sort of treatment techniques isn't the right word, but sort of like pillars of what we're doing from a treatment perspective. Then I was kind of just alluding to it there, but what we want to think about next is what we are modifying in a class or a studio setting. So I was just talking about like range of knee flexion, and what that often looks like is dancers modifying the depth of their plie. And so again, they might say, I'm totally fine with demi-plies, but it's like grand plies really bugged my knee. Okay, we're going to modify that. We're going to stay away from grand plies or, not go into a full grand plie. We can modify the depth of the plie. So that might be one thing we're looking at modifying. We often need to modify jumping. And so again, jumping tends to be the most irritating thing for a patellar tendinopathy. So depending on the degree of the tendinopathy, that might be modifying to them. Well, it could be no jumping at all. It might be only jumps that are landing on two legs. It might be only jumps that are staying in one spot. So they're fine with doing, like sautés and changements, things like that are like petit allegro, not moving. But as soon as they start traveling, that's when it starts to bug them. So maybe we're modifying and saying no traveling jumps. We want to have them be participating in as much of the class and doing as much jumping as they can without making their symptoms progressively worse. So again, we don't want to completely unload these people. We want to keep them doing as much as possible, and using those modifications is often a way to do it. Traveling jumps are often more problematic than stationary jumps for a patellar tendinopathy, and there's some thought that this has to do with like landing angle. The research is not super conclusive about that in terms of if there's like a direct correlation between landing angle and kind of patellar tendinopathy, but just anecdotally or clinically, definitely people often report more issues with traveling jumps than they do with stationary jumps. And it probably just has to do with the amount of control that they have in a stationary jump versus a traveling jump. So we're going to modify their jumping, but again, ideally not eliminating all of it unless we have to. If it is irritated enough, we might have to say no jumping at all. But sometimes it's just modifying the amount of jumping they're doing or the types of jumping that they are doing. We may need to modify kneeling. Again, I talked about this before, but just sort of certain positions of kneeling can be irritating. That might be eliminating it and just not kneeling for a period of time, or it might be using some sort of like a knee pad or something to protect the area. So just things to consider in terms of what styles of dance they're doing and choreographic demands. And then we also might need to look at breaks or like pacing throughout the class. So similar to the Achilles tendinopathy, it may be that from a load management perspective, they actually need more breaks throughout their day. And so the same thing can be said for patellar tendinopathy. Although I will say the patellar tendon maybe gets slightly more breaks during class than the Achilles tendon does. I don't know if that's an accurate statement or not, but I do find that sometimes if people are modifying the amount of jumping or the amount of plieing and stuff that they're doing, that is often enough for patellar tendons. Then they can kind of like participate in most other aspects of class and don't need as many breaks. Whereas with the Achilles, because every time you point your foot, flex your foot, rise, plie, do anything, the Achilles tendon is involved. Oftentimes breaks become a bigger part of load management. So that's just, again, anecdotally what I have observed. I don't know that there's any actual validity behind that statement, but oftentimes we don't need to incorporate extra breaks for patellar tendons as long as we're modifying some of the jumping and loading. And then finally, we may consider patellar strapping or taping techniques. So if anybody has seen patellar straps before, they're these little bands, like it's like a brace, but they're quite thin. It's like a little strap or a band that goes around just below your kneecap, right where the patellar tendon is. Oftentimes they'll have a little padded area that sits right on the tendon. And the idea behind a patellar strap is that it kind of dissipates the force across the tendon so that there's less specific pinpoint load going through one area of the tendon. And some people find these really, really helpful. So patellar strapping is definitely an option to consider. It really seems to be helpful for some dancers. Some dancers either don't like the feeling of the strap or they just don't find it super useful. And sometimes we will also consider taping, and it's the exact same idea. We're usually taping to support that patellar tendon. So the tape is underneath the patella, like where the patellar tendon is. And again, some dancers find it really, really helpful to sort of just offload the tendon a little bit. So those are things you can certainly consider and sort of play around with. Not always the most helpful. I feel like load management and really modifying load as much as possible usually makes a bigger difference to people's symptoms than those straps, but sometimes they are supportive and helpful. So certainly something to keep on your radar. All right, I think that is most of what I have to say about patellar tendinopathy today. Like I said, if you have not listened to some of the other podcast episodes about a little bit more of the pathophysiology of what's actually happening in a tendinopathy, I do encourage you to go back to those episodes because I did not touch on it today, but hopefully this is a little bit of like a practical help or just like a little practical review of exactly how we can deal with a patellar specific tendinopathy. As always, if you have any questions or want any clarification about anything that I talked about on today's podcast episode, please feel free to reach out to me. My email is in the show notes, or you can reach out to me on Instagram at dancephysioerica with a K. Thank you so much for listening, and I hope you have a great rest of your day.